the moment the fertilization occurs, it forms a embryo, and that embryo starts forming the beta HCG. This process of fertilization occurs approximately 72 to 96 hours after ovulation. That means at about 17th to 18th day of cycle, the fertilization occurs. And if the fertilization has occurred, and if we do this blood test of a beta HCG, then we can know whether the pregnancy has occurred in the cycle or not. So beta HCG positive means that the sperm of the male and egg of the female has united or has fertilized and has started secreting the hormone in the blood, which we can detect. So many females come to us with a home urinary cassette test, urine pregnancy test, and there are two lines. We have discussed in previous videos what are those two lines, what is the significance of control line, what is the significance of test line, what does a faint line on a urine pregnancy test on a test line mean, what does a dark line mean. So basically urine pregnancy test measures the amount of beta HCG which is there in urine. The amount of beta HCG in urine would obviously be less than the beta HCG in the blood. So the sensitivity of a urine pregnancy test is still 50 international units per ml. So if the beta HCG in blood is up to 50, then the urine pregnancy test can measure. But it is a qualitative test of presence of beta HCG in the body. So if it only detects the amount, whether the beta HCG is present or not. If beta HCG is more than 50, then urine pregnancy test will detect, but if it is less than 50, the urine pregnancy test or a cassette test would not detect. But beta HCG level of more than 25 in blood or in serum would suggest that the fertilization has occurred. So in many cases, if the urine pregnancy test is negative and female has missed the period, if we want to definitely confirm it, we do a serum beta HCG test. Now what are the implications of the serum beta HCG test or the values of serum beta HCG test? Suppose female comes to us with 1 month and 4 days or 1 month and 5 days amenorrhea, or she has missed her period by 4 or 5 days. We do a serum beta HCG test. If this serum beta HCG test is less than 5 international units per ml, that means that the fertilization has not occurred and the female is not pregnant. Or, I'll come to it later on, sometimes we may be early to do the test. But if it is more than 25, that means that the egg of the female and the sperm of the male has definitely fertilized and it started secreting the beta HCG. Now, does this beta HCG of 25 international units per ml means pregnancy? Does it mean that pregnancy is healthy? Does it mean that pregnancy will carry to the full term and the full term baby will deliver? Answer is no. A single beta HCG value does not tell us about anything about the well-being of pregnancy. It only tells that fertilization has occurred, the sperm and eggs have united and they have formed an embryo and they have started secreting the beta HCG in blood. In a normal behaving pregnancy, the HCG value doubles every 48 to 72 hours. Suppose today on 23rd of September I have done the beta HCG, it comes to about say 72. If I repeat beta HCG after 2 to 3 days, then this value, if it is a normal progressing pregnancy, it has to double. So every 48 to 72 hours, beta HCG should double. That is very, very important because there are few cases in which there is a pregnancy in the body, but beta HCG values may not double. Either it is a failing pregnancy. By failing pregnancy, I mean whether it is a blighted ovum or it is a missed abortion or a aborting pregnancy. In those cases, the beta HCG value may not double. There is a very definite risk of a patient in which the value is not doubling. There is also something called as an ectopic pregnancy. In most of the cases, we are talking about the intrauterine pregnancy, but a deadly and a threatening condition is called as where the pregnancy does not get implanted in the uterus. It may get implanted in the fallopian tubes or somewhere else, but most common is fallopian tubes, and that value may not double every 48 to 72 hours. So the repeated testing of beta HCG after every 48 to 72 hours gives us a definite diagnosis whether the pregnancy is progressing well or not. Now many females come to me with beta HCG value of 600, beta HCG value of 700. They say, sir, the pregnancy is there in the body, but it is not being located on ultrasound. So there is a definite correlation of the beta HCG values and the ultrasound values. In a transvaginal ultrasound, at about 1500 to 2000 international units of beta HCG only can you be able to locate the pregnancy, whether it is intrauterine or extrauterine. So if a female of a 600 or a 700 beta HCG comes to me, and if I am not able to locate the pregnancy on ultrasound, I would ask her to wait for a couple of days more. So 700 means in couple of days more, 48 to 72 hours, the value should double. It should reach somewhere around 1500 to 2000 value, and then I'll do a transvaginal ultrasound. If during that time also I am not able to see intrauterine pregnancy, or I am not able to see a definite extrauterine pregnancy, then I'll keep in mind the definite suspicion of an ectopic pregnancy, and I'll again repeat the ultrasound after 2 days, and again repeat the beta HCG after 2 days. A intrauterine or an extrauterine pregnancy on ultrasound should definitely be visible by a 2000 beta HCG. That is the carry-home message of this question. Now sometimes it so happens female may miss periods, there is a urine pregnancy test positive, and if we do beta HCG, it comes out to 600, 700. We are not able to see any pregnancy on ultrasound. If we repeat ultrasound again after 2 to 3 days, we repeat beta HCG again after 2 to 3 days, the beta HCG value starts falling, and again we are not able to see anything on ultrasound. This entity is called as a chemical pregnancy or a biochemical pregnancy. Chemical or biochemical pregnancy means that while the fertilization of sperm and egg has definitely occurred, it has not implanted properly, and the pregnancy has failed. So that is not actually a clinical pregnancy. Clinical pregnancy means we are definitely able to see a gestational sac on ultrasound, but if we are not able to see a gestational sac on ultrasound, there is only evidence of fertilization on urine pregnancy test and on beta HCG. That is called as a chemical pregnancy. Now while I am treating the patients of infertility, this chemical pregnancy to me is a reassuring thing. Why it is a reassuring thing? Because it tells me that at least the basic processes are normal. The husband semen count would mostly be normal, the egg count may be normal, the fallopian tube may be normal. The only problem is with the implantation, and if I keep on persisting with the treatment I am doing and with the things the patient is doing, then she should hopefully conceive within next few months. So biochemical pregnancy for those females who are trying to conceive with proper prenatal supplements of folic acid, vitamin B12, vitamin D and other things is a very reassuring sign as far as a gynecologist is concerned. Now what is the role of this beta HCG test in ectopic pregnancy? Ectopic pregnancy we have discussed in our Hindi video. We'll again make an English video. Ectopic pregnancy is one in which the pregnancy is located outside the uterus, and most common location of ectopic pregnancy is fallopian tube. Now fallopian tubes are not seen on an ultrasound unless they are filled with fluid or there is a pregnancy, but even to locate an extrauterine pregnancy in fallopian tube is not that easy. So the moment patient comes to us with a missed period, and either she has a urine pregnancy test positive at her home, or if we do an ultrasound we are not able to locate the pregnancy in the uterus. If there is some evidence of probe tenderness, some free fluid, and we find something, some kind of an adnexal mass, we do a urine pregnancy test in our clinic. If it comes out to be positive, then we have a suspicion that there might be an ectopic pregnancy. Mind you, I am using the word suspicion. We are not confirmed yet. If I have a suspicion beta urine pregnancy test comes out to be positive, I will do a serum beta HCG test. If this serum beta HCG test say comes out to be 1000, I'll wait for a couple of days more. I'll again repeat the transvaginal ultrasound and again repeat the beta HCG. Because beta HCG, as I know, it normally doubles within 48 to 72 hours. If that beta HCG from 1000 comes to about 2000 and I am able to see in pregnancy inside the uterus, then there is nothing to worry. But even at the value of beta HCG 2000, I am not able to see an intrauterine pregnancy. I'll try and look at the adnexa, and most likely I may be able to see some kind of a pregnancy or an adnexal mass, gestational sac, or a fetal cardiac activity. I may be able to see. But if I am not able to see, then I'll label that pregnancy as query ectopic. I'll send it for an expert radiology scan, and who will most likely label it as an ectopic. Sometimes, even in a normal intrauterine pregnancy, the corpus luteum of a pregnancy looks like an ectopic pregnancy. So before labeling the pregnancy ectopic, because once you label the pregnancy as ectopic, patient is likely to be terrified. You just say that it is likely that it can be an ectopic. We'll wait for 48 hours more to label and to confirm the diagnosis as ectopic. It is always better to wait for 48 to 72 hours, because in our experience, the ectopic pregnancy, especially in the fallopian tube, usually does not rupture before 6 weeks. So we still have about 5 to 7 days. So it is not an acute emergency as of now. So once we have a confirmed diagnosis of a beta ectopic pregnancy based on the beta HCG values and an expert ultrasound, we will focus towards the medical management of ectopic pregnancy. Now, medical beta HCG value plays a very important role in the medical management of ectopic pregnancy. If it is an ectopic pregnancy, and if in consultation of the patient we decide that we are proceeding for the medical management of ectopic, patient fulfills the criteria of a medical management of ectopic pregnancy, then we would do a baseline beta HCG. We'll give an injection methotrexate in whatever protocol you prefer. I normally prefer single dose methotrexate, and we will repeat the beta HCG again at the 4th day. The first day of giving methotrexate is called as day 0. Again at 4th day we do a beta HCG. In methotrexate is an anti-folate, anti-beta HCG hormone. So by giving the methotrexate, we believe that the beta HCG would come down. But in 10 to 15% of cases, the beta HCG after giving the first dose of methotrexate somewhat increases by 5 to 10%. That is normal, there is nothing to worry. And then we would again repeat at day 7. By day 7, the beta HCG value should decrease by more than 50% of the baseline. Suppose at baseline it was 2000, then it should, by day 7 it should be less than 1000, more means less than 50% of the original value. And then we will repeat again after every weekly till the beta HCG comes to less than 5. This is the medical management of ectopic. Suppose at day 7 the beta HCG value starts increasing, and if that increase is more than 15 to 20% of the baseline, then we may either repeat methotrexate or we may switch over to the surgical management. So beta HCG titer gives a very important management aspect of the ectopic pregnancy management. Now there are few cases in which even there can be a false positive and false negative. False positive means the pregnancy is not there, still the beta HCG test is positive. Many doctors have a habit of giving HCG hormone for support of pregnancy or for support of corpus luteum during the IUI or IVF. That HCG hormone, if it is injected in the female's blood, and if we do the beta HCG test next day or maybe couple of days later, the beta HCG test may come positive. So before making a diagnosis of a pregnancy, we need to properly know whether the beta HCG was given in the pregnancy or not. Also, sometimes if the patient is having a gross PCOD with high LH levels, LH and beta HCG, they have got almost similar biochemical profile, And females who have got increased LH, they may sometimes come as false positive on urine pregnancy test or on beta HCG blood test. Sometimes false negative comes. False negative means pregnancy is there, but the beta HCG test either on urine pregnancy test or on blood test is showing negative. Most likely answer on urine pregnancy test is that female may have drunk plenty of water, the urine may have got diluted, and that is why the concentration of beta HCG in urine may be less. Or female may have done later on in the pregnancy, earlier, very early, before the beta HCG may have started to rise, or beta HCG levels may have been less than 50. Beta HCG levels in pregnancy, like I said, they start secreting at about 17th and 19th day of the cycle, and they keep on increasing till 70th day, till 9th to 10th week they increase, and after that they decrease. After 13 to 14 weeks the beta HCG decrease. Beta HCG is basically an hormone to support the placenta till the placenta takes over, and complete formation of placenta occurs at about 12 to 13 weeks when it starts secreting the other hormones. Till then the embryo requires the support. Sometimes beta HCG is very high compared to the weeks of pregnancy. That means either there is a twin pregnancy, there are two embryos which are secreting more beta HCG, or there is some kind of a malignancy, choriocarcinoma kind of thing, or there is a hydratiform mole. Hydratiform mole or a vesicular mole is a different entity in itself. While it is there are different varieties, complete mole or a partial mole, there may or may not be a viable pregnancy associated. So we have to rule out all those kind of things. Now, most common thing is, suppose you have got a beta HCG test done, you have done an IVF, embryo transfer, and after a 2-week wait, after 14 days your doctor tells you to do a beta HCG blood test. At what value would you say that you have conceived, the implantation has occurred, IVF has success? In my experience, any value more than 500 to 700 international unit per ml is considered positive. If the value is more than say 1000 or 1500, then there is more likelihood of a twin pregnancy being there, especially if two embryos have been implanted, have been transferred. So minimum value of 500 to 700 is a criteria at which you consider your beta HCG to be positive, your implantation to have occurred. Many doctors, when they give beta HCG during the luteal phase support during the 2-week wait, sometimes it falsely elevates the value of beta HCG. I am a firm believer not to give beta HCG hormone as a luteal phase support during the 2-week wait in an IVF cycle, not in an IUI cycle, in an IVF cycle. In an IUI cycle, I want my corpus luteum to be supported, and after doing an IUI, this beta HCG hormone supports the corpus luteum. Corpus luteum would secrete estrogen, progesterone and other peptides which would help in the implantation process. But during an IVF, most of us are doing frozen embryo transfer cycle. There is no corpus luteum. So HCG support is not needed. You don't need anything to support the corpus luteum. And giving HCG during the luteal phase support, during those 2 or 3 injections of HCG, sometimes falsely elevates the beta HCG. So that may create false sense of a false hope in the patient. So any values of say 70, 80, 90, I would say it is a chemical pregnancy unless the beta HCG hormone has been given, and that nothing needs to be done. Some people give rescue HCG, some people again repeat beta HCG after 2 days. You can do it, but in my experience, there is no point of doing the repeat beta HCG if the value has come to say 70, 80, 90. Unless it is more than 400 or 500, there is no point of going further. Sometimes the beta HCG is positive, but there is no pregnancy in the uterus. That may also suggest a recent abortion, a recent MTP pill, a recent miscarriage. That is very, very important. Suppose patient has taken the MTP pill from outside, patient has not told us, she has complete bleeding done because after the pregnancy termination or by a medical medicines or by suction evacuation DNC, the beta HCG still remains in blood for about 7 days. 7 days after doing an MTP or an MTP pill, the urine pregnancy test or a serum beta HCG would still come to be positive. So that is again a very, very important point which needs to be taken care of. Sometimes urine pregnancy test cards are also defective. While many times patients come to us, they have done urine pregnancy test at their home and it turns out to be negative. But when we do an ultrasound, it turns out to be positive. Either the card's quality may not be good, or the expiry date may have occurred. Sometimes, if you see the urine pregnancy card, they come with desiccated powder-like packets which absorb the moisture. If the card has been kept out in the open for long, then also it may give false negative reports. One more important point: at fourth month of pregnancy, if somebody is doing pregnancy test, there is more likelihood that urine pregnancy test may come out to be normal. Many females come to us who may have bled in a small quantity during first 2 months and they still don't know by third or fourth month that they are pregnant. They come to us for something else, for abdominal pain or abdominal distension, and then we find out that this is a pregnancy and they say we did a urine pregnancy test and it came out to be negative. Like I said, beta HCG peaks till the 70 days of pregnancy. That means 7 to 10 weeks of pregnancy it peaks, and after that 12, 13, 14 weeks it comes down. So it is likelihood that after 14, 15, 16 weeks the urine pregnancy test may come out to be negative. So just by doing a urine pregnancy test, you do not go into a false sense of security that my pregnancy is negative, because we encounter such kinds of patients daily. Either do a repeat urine pregnancy test if you are having a doubt, or please visit your gynecologist, get a transvaginal ultrasound done. He or she will rule out the pregnancy. So beta HCG is a beautiful armamentarium in our gynecologist. In foreign countries, they just follow a normal pregnancy by doing a serial beta HCG, because in foreign countries to get a appointment of a ultrasoundologist is difficult. While in India, what we do is we do a transvaginal sonography the moment patient misses period, and at 1 month and 4 days, if patient is getting a regular cycle, we are more likely to see an intrauterine gestational sac in most of the cases. So we save a lot of money of the patients by not doing the beta HCG. Again, for failing pregnancy, I personally believe we do not need to do a beta HCG. It is better to do an ultrasound, because ultimately it is a confirmatory test. There are many things which can be talked about beta HCG, but these are the main common queries which patients come to us and they ask us. So I thought, let's make a video about this. If you have any further queries on your value or somebody else's values, you can ask them in the comment section. You can DM us. Please like the video, share the video, and please subscribe to our channel. Thank you. Namaskar.